welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. FDA approves new treatment for uncomplicated urinary tract infections. The FDA recently approved the sale of an antibiotic called pivmecillinam for the treatment of urinary tract infections or UTIs in women. UTIs are increasingly resistant to existing antimicrobial drugs, making pivmecillinam a powerful new tool for healthcare providers. The drug, marked as Pivya in the US, has been used in Europe for over 40 years and will be available by prescription for women aged 18 and older. This approval marks the first time in 2 decades that the FDA has approved a new antibiotic for UTI, which affect 30 million Americans annually. UTIs are the primary reason for antibiotic use outside hospitals. Pivmecillinam will be available in 2025. MBBS final year practical exam to be held again. Following protests by MBBS students at MGM Medical College in Indore over alleged unfair grading, Madhya Pradesh Medical Science University in Jabalpur has announced plans to reconduct the practical exam for 94 students. The university's examination board made the decision on Friday, scheduling the re-examination to take place within 7 days. Internal and external examiners will be present during the re-examination. While the university has not mandated students to participate in the re-exam, it has instructed the college to ensure proper arrangements for conducting the examination. Vice Chancellor Dr. Ashok Khandelwal emphasized that it is the responsibility of the college to facilitate the re-examination effectively. Ramazan Yilmaz, a 40-year-old man from Bursa, Turkey, visited a private dental clinic for a routine tooth extraction procedure but ended up experiencing a horrifying ordeal. During the implant surgery recommended by the dentist, Mr. Yilmaz reported excruciating pain as the dentist allegedly struggled, accidentally forcing the screw through his jawbone and into his cranial cavity, dangerously close to his brain and spinal fluid. Despite Mr. Yilmaz's concerns and bone-cracking sounds during the procedure, the dentist dismissed them as normal. After realizing the device used was faulty, the dentist proceeded with the procedure manually, exerting excessive force. Mr. Yilmaz's screams finally prompted the dentist to take an X-ray, revealing the severity of the situation. The dentist then allegedly abandoned Mr. Yilmaz at a local hospital and fled. Undergoing lengthy surgery to remove the misplaced implant, Mr. Yilmaz thankfully survived the ordeal, now pursuing legal action against the dentist identified as AD. Mr. Yilmaz faces denial of responsibility from the dentist, who claims it was a medical complication. Love brain disorder diagnosed in Chinese girl. In a peculiar case, an 18-year-old Chinese girl nicknamed Xiaoyu was diagnosed with a love brain after insensately calling her boyfriend over 100 times in a single day. Hailing from Sichuan province, her obsessions severely impacted her mental health and her boyfriend's well-being. Xiaoyu's dependency on her boyfriend led to constant demands for attention and updates on his whereabouts. The situation escalated when her boyfriend ignored her calls, prompting her to throw household objects and threaten self-harm. Her partner eventually called the police, leading to her admission to the hospital. Doctors identified her condition as a borderline personality disorder, commonly referred to as love brain, often associated with childhood trauma and unhealthy relationships. While mild cases can improve with self-management, several symptoms require medical intervention. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.